5 to 7 millimeter in length, consists of the head, what we call the scolex, and a body. A larval stage we called a metacystode. It is that presented in any organ in the body of the sheep, cow, big horses, camel. This is what we call intermediate host. And the man also it is an immediate host, but so it is an accidentally occur. So many of them found stages in the liver, in the brain, in the lung, any part of the body. Above the animals and the man, the hydatid cyst, in the larval stage, it is a formation of a cyst. And this will be contained of many layers. The germinal layer, this is the surrounded by another layer, which is we call it laminated membrane. And inside of the germinal, we have scoleces. This is emerged what we have a broad capsule that represented the future head of the tapeworm. Life cycle. The intestine of the dog, primary host, the ova in the stool, it will be contaminated the grass. When the sheep or cow and animal that eat of this infected with the ova, it will go as intermediate host. The ova it will become to the viscera of the sheep, owl, cows, or pigs or horses. When the slaughter of these sheep, the infected viscera in the garden or street, that's what we see the slaughtering in the street. يعني شوفين دائما يعني في مناطق التقاطعات العالم معلقة الخرفان تذبح وتلقى قدامها يعني كثير من الكلاب السائبة. When this is eating by another dog, it will be formed the cycle of that one. The adult one, it will be formed. But in the human, when eating the infected materials, the food, fruits, vegetables, the hydatid will be go instead from the mouth to the stomach, through the stomach to the bowel, through the portal circulation, it go to the liver. The first station of the hydatid go to the liver. From the liver, it will be go by the hepatic vein to the inferior vena cava to the heart, and from the heart it will be going to the pulmonary, and from the pulmonary also return back to the distribution all over of the body. So the hydatid cyst can affect any organ of the body except two, the hair and the nail. This is the life cycle that we see it. This is the adult one, which called the cystode, have a head and the body only. It will be inside of the dog. It will be shattered by the feces of the eggs of this adult one, going to the intermediate accidentally to the man, or go to the sheep. From the sheep, you go to the intestine, from the intestine and eaten by the dog, and forming the cycle of the hydatid cyst. Now, what is the pathology of hydatid cyst in the lung? We are concentrated hydatid cyst in the lung, not other part of the body, like in the GIT or in the any part of the body. When they come of the larval stage of Echinococcus granulosa in the lung, which is the pulmonary hydatid cyst, which is the more common one in Iraq, it forms a nucleated cellular germinal layer, and this is secreted with the fluid internally, what we call it the hydatid fluid. Externally laminated membrane, we call it acellular. So an inner one, it is a germinal one. The outer of that one, we call it laminated. It is acellular, and also covered by adventitia. This is a fibrous layer. This is formed from the human being as a defense mechanism of that pathology to localize of fat pathology. This is what we call the pericyst. The pericyst is formed from the human being Endocyst, it is the innermost germinal layer, or we call it also cellular layer. Ectocyst, it is an out laminated membrane, or also we call it acellular layer, acellular. Inside a germinal layer, we have this what we call the broad capsule containing scolysis and hydatid sand and fluid. Surgical pathology of hydatid cyst. Because of the cyst inside of a lung parenchyma, it leads to the pressure infection. This is according to the size of the hydatid cyst. It is smaller or larger. One, it is have also the site of hydatid cyst near the bronchus or away from the bronchus. If it is near the bronchus, a small one, it will be the pressure effect. It will be to the cuff. When it is ruptured to the pleura, which is a very rare, or to the bronchial tree, this is the bronchial tree. This is it lead to the allergic and lead what we call it allergic systemic. It should be immediately treated. A partial layer, always we have a layer, multiple steps or stage of the hydatid cyst. If it is completely intact with the three layers, the pericyst, with ectocyst, with endocyst, it is present. This is what we call it an intact or primary hydatid cyst. We call it primary or intact hydatid cyst. If we have a leak or rupture occur in pericyst بالadventitia, that from the human being as a body defense, when have any puncture in that one, it will be need an air enter between the adventitia and the ectocyst, and it will be compressed الhydatid cyst. It will be presented as a crescentric shadow مثل الهلال, crescentric. This is what we call it by perivesicular pneumatocyst. It is a sign of detachment from the adventitia to the ectocyst. If the puncture or rupture have two layers, pericyst and ectocyst, and this is what we read collapsing of laminated or cellular one, it is still intact. It will be appear like a water lily appearance, مثل الزنابق. إذا تدخل على مستنقع شوف الزنابق شلون الشكل مالته، هذا الappearance مالته in the X-ray, it will be like a water lily appearance. This is a puncture in the adventitia and ectocyst. Still endocyst is an intact one. Or we have a complete rupture that occur in all three layers. This is what we call the complete rupture. When this is a complete rupture occur, mean the sand and the fluid of hydatid cyst or scolysis, it will be distributed and it will become from immature and maturation. The maturation of this scolysis lead to formation another hydatid cyst, what we call a secondary hydatid cyst. And this is what we call a daughter hydatid cyst. This daughter hydatid cyst also form then a granddaughter. Maybe it reached to the thousands of the secondary hydatid cyst, what we call it daughter. what we have a daughter, granddaughter. أحفاد من hydatid cyst we form it. Now, when this formation of complete rupture, sometimes the patient is so lucky that he will be expectorated all the layers, الectocyst, endocyst, it will expectorated to the outside. This is fortunately, this patient is so fortunately and lucky that to expel all this content of hydatid to the outside, and it will be lead to the residual cavity. This one has not need any surgical treatment in the future. But sometimes, no, because of communication of bronchial tree to that cavity, it's formation of the lung abscess. This is a worse thing that it will be need an indication also for surgery. Simple hydatidis, as we call it, when you have an intact. This is what we call a simple or primary hydatidis. Simple or primary, this is a complete intact hydatidis. Complicated one, either it will be partial rupture in the adventitia that we call the perivesicular pneumonitis, or maybe have a water lily appearance. This is a puncture in the ectocyst beside the adventitia. This is a water lily, or we have a lung abscess or residual cavity. And the primary hydatidis developed from the ova, life cycle, and this is eaten by vegetables and go to the stomach, from stomach to the portal circulation, from portal circulation is go to the first station in the liver and then to the lung and distributed all over of the body. An adult worm or ovo or primary cyst, then a larval stage that it form the hydatidis may be ruptured to form secondary hydatidis, or that what we mentioned previously, what we call it the granddaughter, أحفاد. Now, the clinical feature, as I mentioned before, is depend on the size and site of that one, and also what stage of hydatidis, either it is an intact or partial rupture or complete rupture or residual cavity or an lung abscess formation. Always when you have a peripherally, not a compressed small one, maybe have asymptomatic and accidentally discovered by the routine chest x-ray, or we have this patient he need to do an surgery and he need to do in the previous before any surgery you do a chest x-ray. Maybe have a dry cough when have a compress on the bronchial tree, lead to the dry cough. If it is a rupture of hydatidis, it will be have complicated, either it will be have a fever, malaria, or sometimes in rare cases we have hemoptysis. And perivesicular pneumonitis, a slight cough we have, but water lily appearance. Sometimes this cough have a fluid, it is a salty fluid، مثل الملح، يقول لك والله أنا دا أقح والبلغم اللي يطلع مالتي مثل المي ملوحة. And sometimes this associated with the crepe skin، مثل قشر العنب، يقول لك والله كل ما أقح دكتور تطلع لي البلغم مالتي مثل المي المالح ويا مثل القشر العنب مالتي. This is معناته it is a partial rupture of the hydatidis. This is in case of the water lily appearance. A daughter cyst have a many cysts in the body, it is more than one hydatidis. It lead to the cough because of the pressure effect of that one. When formation of the abscess, this patient start from the normal asymptomatic or have only cough or have sputum. Now it is start with the high fever, leukocytosis, and rigor. Coming, it will be virulent, foul smell, and secretion of the greenish color sputum. How you can diagnose the hydatidis? Routinely by radiological appearance, chest x-ray. Always don't forget, in chest problem, you should be took a two view, PA and lateral, not AB, PA and lateral. Always in the chest problem, you should be took two views, in PA and lateral one. By chest x-ray, it's depend on the stage of the hydatidis. If it is an intact, it will be have a well circumscribed border, round spherical appearance of that one, homogeneous opacity. Maybe it is a single or multiple, and maybe it is unilateral, in one lung, or maybe have a bilateral. In both lungs we have an hydatidis. Sometimes when you have a rupture, this is what we call perivesicular pneumocyst. perivesicular nemocyst, or what we call it a crysenteric shadow. يعني شوف الوتر يعني it will be like the hydatid cyst, it will be like a crysenteric appearance مثل الهلال pain الشادو مالته. Or maybe have a water lily appearance. Water lily appearance, if it is a rupture of the ectocyst beside the adventitia, it will be appear fluid, and on the fluid it will be a wavy appearance of the germinal layer, wavy appearance of germinal layer. So it will be call it a water lily. Or sometimes it will be presented as a residual cavity, only have a round cavity, black in color. It will be shown in the chest X-ray. Or maybe have a lung abscess. Lung abscess, this is a fluid appearance with the gas. Fluid appearance with the gas appear in the chest X-ray. To confirm your diagnosis, you need to proceed it for more sophisticated, what we call the CT scan of the chest. And always you need to do an abdominal ultrasound to exclude there is any hydatid cyst in the liver or the spleen or in the bowel. This is what we appearance of that one, what one. This is it will appear the perivesicular one, and what appear in water lily appearance of that one. This is as shown in the arrow that show in the chest X-ray. How we see this is a round shadow. This is in the left lower lobe, and this is in the left and the right upper lobe, and this is in the left lower lobe, a lateral view. This is what we appearance here. As we see, there is a water lily appearance, and in that one, it leads to the abscess formation. This is a CT scan appearance of the hydatid cyst, and this is also have hydatid cyst of the only the rib. By the way, I have published a paper recorded cases of only hydatid cyst of the ribs. I reported in my paper. I collected many cases only affected ribs, not affected the lung or parenchyma. This is also the cavity that appeared. The cavity, this is an empty cavity in CT scan. And this is also usually a multiple hydatid cyst. You see it on the right lung, by CT. And this is by endoscopic, bronchoscope. By bronchoscope, you see this is an intrabronchial hydatid cyst, very unusual when you see an hydatid cyst inside the bronchial tree. Now, beside the radiological to confirm your diagnosis, we have also immunological investigation. Now it is not practically, only for academic purpose. more routinely it is for immunology. أسوي ELISA test للمريض، أقول له والله do an ELISA test to confirm this hydatid cyst or not. الكازوني test هذا intradermal، تحقن part of the fluid inside the skin, and there is any reaction like a tuberculin test. Latex, the anticoagulation test, or ELISA, this is only for academic purpose. But routinely, when you do a complete blood count, you should be searched for the eosinophil, because it is a parasitic infection. Eosinophilic, it will be an increase in the number. A parasitological examination, when you have this patient, you have a fluid, he said have a sputum, this is a bitter or salty with a crepe skin. We take it for examination. Maybe you find the membrane of hydatid cyst in the sputum. Now the treatment. There is no rule for medical treatment, only a surgery. Yes, sometimes we use post-operative to prevent any leaking or contamination of the field, maybe we use albendazole 400 milligram for 1 month to 3 months. This is to prevent seeding. يعني maybe during the surgery you are unfortunately you have a rupture of the hydatid fluid. Yes, we take all precaution to prevent any contaminated from that fluid, but precaution when we have suspicion of leakage, that we advise this patient to take albendazole 400 milligram for يعني 1 month to 3 months. Sometimes he said, radiological, he said, why we not do an aspiration under guide of CT scan or ultrasound, because this is an intact. This is absolutely contraindication. Absolutely contraindication. Why? Because when you do an aspiration of hydatid cyst under guide of the CT scan or ultrasound, immediately when you puncture it, if there is any fluid inside the pleural cavity, it leads to the anaphylactic shock. Second, when you do a leaking, when you do a puncture of the hydatid cyst and you take the fluid outside, maybe it will be, there is some leak around the needle, it go to the inside the pleural cavity, lead to the secondary formation of hydatid. Third one, still you keep the germinal layer inside. The germinal layer, it will be always formation of daughter cyst. So this is absolutely a wrong procedure to do it, an aspiration by radiological and the CT scan or ultrasound. Contraindication. Now, when we have hydatid cyst, we do a surgery. Surgery by thoracotomy or thoracoscope. Always when we have an intact hydatid cyst, it is intact hydatid cyst, avoid to rupture it. احنا لما نشتغل عادة بالعملية لما نشوف الhydatid cyst, it should be isolated the area by using a betadine pack all around the area of the parenchyma surrounding the hydatid cyst. Many procedures we do it. If it is a big, fortunately, maybe when to remove it by inoculation, أشيلها بأكملها intact. Sometimes maybe I afraid from the rupture of it. So I do aspiration, evacuation. I injected scolecidal material. شنو scolecidal material? I use hypertonic glucose water 50% or hypertonic saline, or maybe I use a betadine or Savlon or Hibitian, or even I use a formalin, or I use an absolute alcohol. This is, I will inject it inside the hydatid cyst. I will be wait for 10 minutes. It will be kill all the germinal materials, scoliosis and the fluid, the sand, it will be killed. And after that, I do an aspiration and I open and I remove the ectocyst, and endocyst of this. And after that, I closure the cavity of that one, or I open it by marsupialization of the edge of that cavity. For me, more routinely, I not use an absolute alcohol because it will be leaking to the bloodstream. يطلع المريض ورا العملية سكران يقول الدكتور يا بعيد لي العملية هاي خوش عملية صارت بالنسبة لي. Formalin maybe leakage, it lead to the sclerotic materials, so I try to use it. I prefer my personal to use an hypertonic glucose water 50%. If it is a peripheral and a small one, sometimes I do an excision. I remove part of the parenchyma with the intact hydatid cyst. Sometimes we do a resection, removal of the part of the lung. If it is the cyst, it is with the daughter one and have an abscess formation. I do sometimes segmentectomy, part of the segment of the lung, or maybe I do lobotomy, and very rare, I do pneumonectomy. Very rare, I do pneumonectomy. This is الهيداتس see in the peripherally in the segment, and this is have a multiple one also, that when we do a resection for them, this is how it will be appear, the ectocyst and endocyst, and the adventitia. This is a white arrow, that the adventitia, this is a body defense. This is how it will be appear, This is the hydatocyst, and multiple hydatocysts, we see it. And this is how we do it, by inoculation. We should be remove the adventitia very carefully, and peeling of that one, ectocyst, and we remove the endocyst completely. This is what we have in this picture on the right side. This is the hydatocyst, how it appear in the surgery. This is how it will appear when I open the adventitia. This is a reactionary defense from the parenchyma, the body host. After that, we see this is a germinal, and ectocyst with endocyst. This is how to be always isolated, by using a bag soaked with the scolycidal material, to prevent any spillage from the fluid that occur during the inoculation or aspiration or excision. Sometimes this is in lung abscess we do, and you have a lung abscess, we do what we call it in rib resection, and inverted of the skin at that area. Now, as a medical therapy, I told you it is useless, but we think this is, maybe it is prevented when I suspicion of there is a spillage of the fluid inside the field. So I always I wash the field many times with scolycidal material like Hibitian. I wash it, but always when I have any suspicion, I give albendazole for them. Second things, a dog. We have two type of dog. We have domestic dogs that we keep it. The dogs should be keep it outside the house. مو تجيب الكلب وتنيمه بحضنك وتخليه بالفراش وتمسد له. always we have a domestic, keep it outside the house. stray dogs ما شاء الله هي كلاب السابع بالعراق بكثرة ما شاء الله، هم كثرة الكلاب. It should be eliminated of that one. it should be terminated and eliminated of that one. سابقا كان اكو حملات من البلدية ووزارة الداخلية بقتل الكلاب السائبة. تجي على sheeps والdogs should be not allowed to be slaughters. slaughtering it should be done in the right places. انت ما ممكن تخلي لك تسوي لك جوبات في كل شارع وفي كل تقاطع تحت الجسر، والله تقعد وتذبح وكلاب يمك وشغلات. الشد بالسلترنج مسالخ خاصة حكومية، ويجي الطبيب البيطري يختم على الشيبس يقول انه هذا this is not infected. If any infected of that one, it will be completely eliminated and destroy of that one. The man always keep the dog outside the house and washing the hand and washing the vegetables. انت ما جاي تقعد مثل دولة بايعين الخضروات. عادة بايع الخضروات ابني لما يشوف الخضروات يم راس الخس او شغلات خلى لك اياه هيك يغسل لك اياه وكله مباشرة بدون الغسل بشكل مضبوط. Now I have two questions, Babati. I have two questions before I finish my lectures. First of all, when you have any questions, I told you in the beginning of my lectures, I said the hydatocyst affected all part of the body except the hair and nail. when we have a multiple hydatid cyst in the brain, in the lung, in the liver, in the spleen, in the intestine, in the ovary, in the any part of the body, even in the bone, even in the skin, or any part, any part. Now, the priority for whom you should be start. يعني جاك المريض عنده hydatitis of brain, وعنده hydatitis of the lung, وعنده hydatitis of the intestine, and the hydatitis of the lung, and the hydatitis of the bone, and hydatitis of the lung. Which one it should be start?
دكتور البراين.
Always you should be start with the lung, with pulmonary. Why? Why you should be start with the pulmonary hydatitis, not another one? The hydatitis, because when you do an endotracheal tube during the anesthesia and give this patient under ventilator, maybe it will be lead to the rupture of that one. Rupture. When it is rupture, يعني, it will be lead to anaphylactic shock. Anaphylactic shock means the patient will be killed on the table of theater. عندها تشتغل على البرين وانت عندك ما تدري اكو hydatitis of the lung وخليت المخدر وسوى لك الرupture, immediately lead to anaphylactic shock and collapse and dead on the table of theater. For always the priority to the pulmonary hydatitis. Second questions. I also mentioned, if you remember, by the side, I said maybe hydatitis occur in bilaterally, يعني right and left, right and left, right and left. Which side I choose first, left or right?
left
Somebody
دكتور.
said I use the left side. Why you choose the left side? He said because it's
الهارت.
near the heart. No. First of all, if I have a bilateral hydatitis, always I choose the bigger one. يعني إذا عندي أنا بالرايت side bigger than the left one, I choose the bigger one. Second, I choose the side that have a multiple hydatitis. يعني عندي بجهة موجود 2 hydatitis or 3. Another side I have 1 hydatitis. I always choose the complicated one, not the intact one. يعني أنا من الأجيال اللي قالت لي هنا موجود عندي rupture hydatitis, water lily, or lung abscess formation, I choose that side, not use the intact one. Another things, I have a bilateral hydatitis, left and right one, and beside that, I have in the liver hydatitis. I use to do a right thoracotomy because I do a transdiaphragmatic approach to remove hydatitis of the lung. Beside, I can remove hydatitis of the liver in one stage. يعني ما يحتاج أسوي عمليتين، يحتاج أسوي عملية واحدة تكفيني بالنسبة لي أفتح ثرى. Also, if there is spleen, I choose the left side. I do left thoracotomy, remove the hydatitis of the left lung, and I remove also the hydatitis of the spleen, or I can do splenectomy through transdiaphragmatic approach. Now, he said, okay, doctor, I have only bilateral hydatitis in equal size. Which side I choose? Always you choose the side of complaining of the patient. المريض اللي يقول لك أنا اللي عندي ضيق النفس والوجع ده يصير عندي بالجهة اليمنى أو الجهة اليسرى، مع العلم أنه يجوز اللي يشكي بها الجهة اليمنى هو الهيداتس مالته أصغر من الجهة يعني الأخرى. For always you choose the side of the complaining of the patient، لأنه طامة كبرى إذا سويت له العملية في الجهة الثانية يبقى complaining، يقول لي هذا this is more indicated أنه هذا أكبر احتمال يصير أو كذا. Always you choose the side of complaining. Thank you very much for your listening, and I hope for you a happy new year. Thank you very much.
دكتور في السؤال